This is Lichaa, interventional cardiovascular specialist, presenting a case of balloon pulmonary angioplasty and a chronic thromboembolic pulmonary hypertension case, failing medical therapy, and a non-surgical case. As we often experience, the transition to the right pulmonary artery with the equipment is rather difficult sometimes in pulmonary embolism and CTEPH case interventions. In this case, obviously, the case was started with a right heart cath, which was exchanged for over an 018 Gladius wire for a headhunter catheter. And every time we would advance a stiff Amplatz 035 wire through the catheter, it would prolapse to the left pulmonary artery, as we have all experienced in our cases, like in this case. So in that case, we decided to get the Gladius supportive 018 wire to the left lung and then advance a 6 French pigtail over it. We maneuvered the Gladius 018 wire. It's important to have a supportive 018 body in order to be able to open up the pigtail. And then the biggest difficulty here was every time you would advance the Amplatz, it would prolapse. So we decided to get a regular J wire into the pigtail catheter and then advance the 7 French by 45 centimeter sheath in a telescoping fashion, like you see in this case, over the pigtail with a J-wire in the pigtail. Advancing over the pigtail alone would prolapse the entire system, so it definitely required an 035 wire in it without prolapsing it. So selective right lower lobe angiography was performed. As you see here, there are multiple branches missing, including the right medial and right anterior lower lobe branches A7 and A8. The intervention was performed on the A8 anterior segmental branch of the right lower lobe with a 2.5 balloon, resulting in a successful physiologic result, an increase in cardiac output by 1.5 liters per minute, decrease in pulmonary vascular resistance by 2 Wood units, and a decrease in pulmonary artery pressure by 10 millimeters of mercury.